And I've just emerged from a hellish night. But one of the advantages of not sleeping is you get a chance to do some serious thinking, and I'm pretty determined what my next big project is going to be. Because I have been so impressed by the doctors and the nurses working around this hospital and working in the NHS, and I've been so dismayed and concerned about the bureaucracy that simply doesn't seem to be integrated or coherent, and we have so many bureaucrats working in the NHS, and they seem to be perpetuating a bureaucracy that isn't fit for purpose. So one hospital doesn't talk to another hospital, getting your notes from one place to another doesn't seem to work very effectively, and so on. And I think at the same time we need to seriously question how we integrate and how we reform both the NHS bureaucracy and private healthcare. And you think, oh my God, he wants to privatise the NHS. I really don't. I really don't. But that big debate about private healthcare needs to be had. And it often falls into a sort of left-right challenge, and people on the left will often say, no, private healthcare is wrong. But at the same time, they're likely to be paying for PET plan, and then they're likely to find that it doesn't work as well as they wanted it to work when they need to claim, when their pets are ill. And the reason it doesn't work is because the healthcare system for animals and for human beings, the private healthcare system, is predicated on the insurance model, which was designed for motor cars and for homes. It works for motor cars, it works for homes, it really doesn't work for humans and for animals. So we need to rethink this, and we need to challenge the entire industry. Other countries have managed to integrate a private and public system, so that people who can pay and want to pay are not crippling the access to the public system. And we need to make sure that we're somewhere in that direction. We must never question the access to everybody and the ease of access to everybody that the National Health Service can and should be offering. That means waiting lists need to go down, and we need to find ways, creative ways, of getting those lists down so this system is manageable, because at the moment it's a breaking point. And I thought it was very interesting looking at Scotland. I had two calls yesterday. One about a fellow who had a back problem, and when he asked his GP if he could pay for support, and he was put off work and given elephantine painkillers, the GP said, well, it's against NHS ethics to give you a list of private osteopaths and therapists. This seems nonsensical, to keep a person off work simply because you can't provide them with private health advice which they want to pay for. Nonsensical. And the other thing is about the Highlands and the Islands in Scotland, and they have great difficulty attracting GPs. Now, I think the problem is that the conversation is had at the wrong time. If, for example, you went into a classroom and you asked a whole class of children up in the Highlands in Scotland, now, what would you like to do? Would any of you like to train as doctors? Would any of you like to become pillars of your community, to elect to stay here after your training and to have a good salary and to be seen as somebody who is promoting the best values of the NHS? I'm sure there'd be a stampede to sign up. Instead, that conversation happens after medical school, and you find people look at these options of going up to a small village or a small town in one of the remote Highland locations. You know, a place without a cinema, a a place with very limited transport, a place where people are going to be isolated from their friends, it's not that surprising that it's very difficult to get placements filled. So the conversations are taking place at the wrong time. We need to rethink that. And I would like, therefore, to have a conversation, first of all, with an old friend, a fellow called Humzah Yousaf. Now, Humzah and I go back to 2015, when Humzah was insulted by an MEP, a UKIP MEP called David Coburn, who confused Humzah's name for a joke with the name of a convicted terrorist serving a sentence in New York. It was unforgivable. Mr. Farage and I had a bit of a spat over this, and Farage was saying, "Well, it's just a joke." It wasn't. Just a joke is something which is cleverly plotted and which isn't personally offensive without intent. Causing unintentional offence means it's not a good joke. You don't know what you're doing. And David Coburn didn't know what he was doing. And he never apologised, nor did Farage. And I had some very positive conversations with Humzah Yousaf, who is now the person in charge of health in Scotland. So I think that's a really good place to start. And I'm going to come back to this over the next few weeks. So expect more of these conversations about healthcare, about our national health, and I'd love to hear your views on that. How can we get the bureaucracy right, so this is a health service which works for us all, and how can we make sure the waiting lists go down and unfairness is ruled out in all possibilities, and that everybody in the United Kingdom has access to a good GP and to a reliable healthcare. So I'll come back to this shortly. Meanwhile, do follow my channel and ring the bell. I look forward to that. I'm going to see if I can have a bit of a snooze.